Do the majority of people with Parkinson's suffer from depression, anxiety, or both? And I know, Roseanne, we talked a little bit about this. The percentage could be as high as 50%. Do most people have some form of depression and anxiety?
At some point, the answer is most likely yes. And again, the type of symptoms they have, how long they last, the way in which they impact them, is going to vary greatly from person to person. But I think it's so important for everybody to know that if you're feeling any symptom that you don't like, that makes you uncomfortable, maybe you're worried, maybe you're what-ifing every decision that you're considering, you're finding yourself avoiding activities in your life rather than embracing them, you're becoming more isolated, you're always predicting worst case scenario, those are really good red flags that suggest maybe I should talk to somebody about this.
Okay. And our next question, how do you know if your partner suffers from depression and anxiety, or one or the other? Baz?
It can be difficult even for a spouse because it kicks on very gradually. But some of the symptoms that Roseanne was referring to, always seeing the dark scenario, loss of appetite, problems sleeping, always be worrisome, and not being the same person you were once married to, can be signals that something's going on. And I would always recommend a low threshold, a low bar, to immediately seek advice, an expert opinion.
Can Parkinson's medications cause depression and anxiety?
Nope. If anything, as we talked about earlier, the lack of dopamine in the brain can cause a depression, and it can cause anxiety. In fact, we know from people who are treated with dopaminergic medication and where they experience fluctuations in the response to the treatment, not only is in an off phase when the medication isn't working well, are the motor symptoms worse, slower walking, more tremor, but they can coincide with more depression and more anxiety, which then immediately improves after intake of medication. So medication doesn't cause the problems, it's a treatment.